Well, India is battling the second wave of this pandemic with over 2 lakh cases in a consecutive 4 days. The health infrastructure is completely crippled, with every state now essentially complaining about shortage of oxygen, ventilators and even drugs like remdesivir. On the other hand, as far as the centre is concerned, Prime Minister Narendra Modi has already taken stock of the situation with a focus essentially on ramping up the vaccine production. As far as oxygen supply is concerned, there too we are given to understand that the government is essentially playing the role of ensuring that more oxygen cylinders are available. And as far as ramping up production for remdesivir is concerned, the centre has essentially taken note of the hoarding complaints that have come from various states. But what exactly needs to be done at this point in time? The situation certainly appears to be grim, especially from at least 11 states which have seen a huge spurt in the last few days. Joining us in this broadcast are top medical experts who would basically answer your questions. I'm given to understand that Dr. Sanjeev Bagai, Dr. D.K. Gupta, pediatrician and CMD Felix Healthcare, Dr. M.C. Mishra, who's the former director of AIIMS, and Dr. Vivek Nangia, principal director and head of Max Smart Super Speciality Hospital, joining us on this broadcast. Let me first begin with you, Dr. Sanjeev Bagai. As far as the current situation is concerned, the numbers essentially pushes you to think that the situation is extremely grim. What's your assessment like? And then probably we'll also be discussing as far as the solutions are concerned.
Good evening everyone. So I'll answer your question in two parts. One is where the deficiencies are, and second is just very quick suggestions as submissions. So I think the deficiency very clearly is a lack of coordination, at least in Delhi NCR, with regards to the ambulance services, oxygen supply, critical drugs, which includes remdesivir, tocilizumab, and other essentials, and of course availability and access to hospital beds and ICU beds. Now, the other issue is really that the government app is not reflecting and correlating with on-ground availability of the bed. So that is causing a lot of grief and stress on critical patients. Now, what are the things which we can do? What is extremely important is we need to decongest and decompress the hospitals because they're bursting at the seams. I think the full concept of home care needs to be revisited. And we should immediately start what we call as home triage. Almost 80–90% of the patients are mild or asymptomatic or pre-symptomatic, or indeed they may not have COVID. Every fever is not COVID. Let the expert decide on ground rather than the patients flooding the hospital. The second is we need to ramp up the testing. The labs are running dry of staff, of equipment, of supplies, of the reagents. I think it's a supply and demand gap which we really need to ramp up. Point number 3 is enhance the vaccine drive, do target vaccination on the most vulnerable. Any vulnerable above the age of 18 should be included now. It's now or never situation really from the vaccine point of view. And last is we have to do genomic sequence as a routine. If you don't do the genomic sequence, you will really not know what the impact of the changes of the mutations of the virus. Each virus behaves differently, and we know how they behave in terms of infectivity, transmission, in terms of having a greater case fatality, escaping the effectiveness of the vaccine, or indeed the neutralizing antibodies in the body. So I think we need to recalibrate our strategy, not only with regards to vaccination, but my suggestion is make the beds available in the hospital for the real critical patients, have home care as a parallel vertical, a strong vertical, and home triage. A patient can not go to the hospital each and every time. They can be checked at home and made comfortable there. If it's not COVID, they don't need to step out at all.
Well, Dr. Vivek Nangia, let me also bring you in with respect to the role of private hospitals at this point in time. There have been several complaints. We do know that as far as the infrastructure is concerned, it's been completely strict. Having said that, the role of private hospitals becomes extremely crucial. The numbers that have essentially been provided by the private hospitals as their emergency numbers that people can perhaps get in touch with. In fact, Republic TV has also done a reality check. We've tried getting in touch with several of these numbers that have been put forth by the private hospitals. It's in fact very difficult for people to get across for at least the emergency numbers are concerned. So how do you essentially tackle the surge that you're looking at right now, even the role of private hospitals at this point in time?
So thank you for asking me a very valid question. Actually, as you all understand that we are going through a warlike situation again, which is there last year also. And again, it has started surging now for the last couple of weeks. And it isn't easy to be handling such a lot of stress and such a lot of patient load, literally even in the private hospitals. So far we are coping up, but I don't know how long we'll be able to cope up like this. It becomes very essential for all of us to start exhibiting some degree of self-restraint now. So, there was this group chat that we have. On that, I was reading a message where one of our bed manager was writing that he's received 500 messages since the morning asking for a bed in the hospital. So obviously no hospital or no individual can actually cope up with this kind of a workload. And the pressures are too much, but yes, we are still coping up, and I'm sure we'll be able to weather this storm that we are facing right now. So every hospital probably has appointed a nodal officer, a bed manager. There's a complete administrative team which is working on it to be allocating the beds on a priority basis to those who deserve the most. And so as my preceding speaker also said, that triaging the patients is very, very important. Who really requires to be in the hospital is very essential to be decided. There's a proper criteria that has been laid down by the government and the Ministry of Health, which needs to be followed literally to its principle and the spirit, that only people who require hospitalization should come to the hospital. Otherwise, most people can be managed at home.
Well, in fact, gentlemen, we're opening up the lines for a lot of our viewers to come in, because what's very important at this stage is to find solutions rather than just harping on the problems that we are facing. Everyone knows that the health infrastructure has been completely stretched. But having said that, it's time to work on solutions. Joining us on this broadcast is Dr. Rajiv, who's joining us from Telangana. Dr. Rajiv, we've got medical experts on this broadcast. Go ahead, ask your question.
It's not a question. There are few suggestions. Number one is we have lost valuable window period that we had of 5 months to ramp up production of. We have lost a lot of valuable time of 5 months to increase the production of vaccines in the country.
Go ahead, Dr. Rajiv.
Of 18 years plus, because these young adults are mobile, they are transmitting the infections to the other senior citizens at home, to the children. So the people who are actively mobile in the community need to be vaccinated too.
Right. Well, valid points, Dr. Rajiv. I'll also take this up with all my panelists on this broadcast. Dr. MC Mishra, let me ask this question. Did India actually drop the ball, especially when the numbers dropped in the month of February? In fact, there was a story that we are looking at right now. The DRDO, the facility that was outside just next to the airport, which had about 1,000 beds, was wrapped up the moment the numbers had dropped. So don't you think somewhere down the line, the administration did actually let the guard down? And that's the reason why today we are facing a situation where we do not have beds. People are scrambling. They're finding it difficult to find their beds. And that's the reason why perhaps a lot of people would be panicking.
Yeah, this is what looks like that we all were taken by surprise, and we were not prepared. And we all thought with vaccine coming in, numbers going down, that COVID will disappear in March, not realizing that India's trajectory of pandemic has been 2 to 3 months behind Europe and USA. If you remember, in November and December, or even January and even February, when our infections were going down, there were lockdowns in Europe, in UK. The infection with particularly with mutant viruses in UK, South Africa and other places were increasing by the day. And we should have anticipated this second wave or whatever we call it, and we should have let the infrastructure in place, but that is hindsight. Naturally, now what we have to look at in perspective. In perspective, what immediately we all can do, which includes me and you and everyone, that we start preventing infection from happening. That is the most important step towards coming out of this crisis. Otherwise, if people do not listen, if people do not behave, I'm sorry, we are heading for even worse scenario in coming weeks. So this is one thing which we have to realize, that we must cover our faces. We remain at home as far as possible, and governments will also have to come with these strict measures as we saw last year in April and May. It is a surgical operation, has to be done in the form of lockdown to bring down the numbers, because we do not have, simply we do not have the resources. Resources are grossly short of demand. So we do not have the kind of resources needed. People are flocking labs, people are flocking hospitals. There are no hospital beds, as all your stories are telling that. There are number of ambulances waiting outside each hospital. There are ICUs are full. People are getting sick by the hour. And not every person needs to go to, as Dr. Bagai was mentioning, the home care has to be rejuvenated and strengthened, whichever way we can do that. And that is something which is the need of the hour at this point of time. People should forget about getting COVID test and getting the report after 4 days. That has no meaning. By the time, if people have symptoms, consider it is COVID till proved otherwise. So start the treatment as soon as you have any symptom of fever, sore throat, or any headache,
Right.
and the breathing problem, lethargy, weakness, any symptom, because COVID has a very wide spectrum. On the one hand, we have asymptomatic or patients with least symptoms. I would not say asymptomatic, because asymptomatic we don't know, but least symptom to grave symptoms. And that is the spectrum we have witnessed over last 1 year. And if people just prevent this infection from
Right.
happening, they'll prevent themselves going to hospitals and ICUs. I think that is something everybody of us have to realize that and follow this very strictly. I'm showing 2 masks. You don't put one, put 2 masks, double mask, and prevent yourself wherever you have to go for some work, very urgent work. Otherwise, do not go out. And even if you have a infected person at home, you have to use this, and do not mix up, do not eat food together, don't go to the any function or anywhere. And the only savior at this point of time is
Right.
mask. Mask can prevent infection from happening 96% times.
Well, thank you very much, Dr. MC Mishra. Perhaps in this broadcast, what we would essentially be doing is looking at those solutions. What is it that we can do? We all know that the situation is grim, but having said that, there has to be a silver lining, and that's why we would be focusing. So, all of you who have a query, there's something that you would want to be answered, our medical experts are here. They would answer your questions. So, we're getting another caller right now from Mandya. Sanjana, who's joining us. Sanjana, go ahead, ask your question. Is there any specific person that you would like to ask your question to?
My question was this only. Namaste, sir. Because, despite of the fact that so many have taken the vaccinations, we have seen the side effects as well due to the blood clots, so many found dead. And how that is going to be work with new dosages means if someone has taken the previous dosages already, and if they are supposed to take the second doses, then how can they ensure the safety to themselves?
Right. Dr. D.K. Gupta, let me also bring you in right now. You've heard the caller essentially talking about the problems that we have been witnessing. But Dr. D.K. Gupta, what is it that we can do at this point in time? We do know there is a shortage of beds, be it in the national capital or for that matter in the financial capital. But let's take it this way. If today I develop some sort of symptoms, what is it that one should be doing immediately? Because a lot of people that I've spoken to, they are worried. They feel that the need is to go to the hospital immediately. Is that the case? How should one tackle the situation?
The most important question, we should discuss it now. And currently there is overloading of the beds in the hospital because of mismanagement of the beds, mismanagement of the triage, mismanagement of the emergency, as discussed by previous panelists also. We need something primary healthcare centers at a society level or at a community level, because already the spread is in the community right now, and everybody is now aware that it is mostly we have infected or affected either in either way every person of the society right now. So we have to set up some primary healthcare center in the society, make a isolation ward. In the doctors residing in the society, there are one or two doctors who each and every society there are two or three doctors are residing in the society. They should do morning and evening visits, and nearby hospital, whatever it is, they should assist in providing paramedical staff and nursing staff to take care of these patients. The 90% we know that patients are mild or asymptomatic, they can be treated at home or in a daycare center. Even home care patients, those who are in isolation, those can be also managed through the call center in this primary healthcare facilities. Even the patients who are in tertiary or secondary care hospital, they can be early discharged with the advice to visit these nearby centers for further follow-up. So that we need to decongest our tertiary care and secondary care hospitals. We need emergent beds for serious patients, not for everybody. Because mostly the patients in the Delhi NCR and Tier 1 and Tier 2 cities, they are covered by insurance. And now panic is so much high in the society that everybody who is right now having COVID positive, asymptomatic or mild symptoms, they want a bed, they want oxygen, they want remdesivir. There is no need of remdesivir for each and everybody. We know that it do not affect the mortality of the patient. It do not prevent the death of the patient. It only shortens the stay of hospital of the patient. Therefore, every patient do not require this remdesivir also. I think there should be clear-cut guidelines also, and now this is time to control this pandemic. We can control only by thinking out of box, something like innovation, like there should be participation of RWS, volunteers, NGOs, hospitals and doctors residing in the society to make a small setup inside the society, be it community center, be it Baratgar, be it a clubhouse, be it any open covered place, 1,000 to 1,500 square feet, where we can put 10 or 15 beds, where first aid and daycare and even emergency can be handled. Even for referral, they can be act as a first referral unit to nearby hospital. They can have extra beds for these hospital to accommodate these patients, so that there can be channel of first referral and back referral also. So otherwise it will not happen. There will be chaos. Already there is a chaos.
Right.
We need to think it, and government need to think in on that.
Well, gentlemen, I would request all of you to stay on as we're getting one more caller. The caller is now from Kerala, and what's being told. CK Narayan is joining us from Palakkad. Mr. Narayan, go ahead and ask your question.
Good evening, sir. Sir, I'm CK Narayan from Palakkad speaking. Sir, I'm having my mother. She is a super senior paraplegic, and I am a comorbid patient. Is it advisable for us to go to a COVID vaccination center under the present condition, or should we wait for some more time because it's our second dose is due?
Right. That's a very important question. Dr. Bagai, perhaps you can take this, because right now the other fear is that should we go ahead with our vaccination, as Mr. Narayanan was also pointing out, what happens in a situation like this? What is it that you would like to advise Mr. Narayanan, who wants perhaps to take his mother for the vaccination?
Okay, I think this is, if you ask me, in the entire debate of all the channels today, this is perhaps the most key question. Vaccination is the most important public health tool which we have is to break the back of this pandemic. Now, what are the points why the mother and the fathers of all of our families and our grandparents must get vaccinated? Age is a very important and independent criteria to indicate severity and mortality of this disease. There is a concept called as immunoaging. Your body cells in terms of B cells and your antibodies and T cells weaken with age. Point number 2 is all comorbidities. Apart from aging is obesity and hypertension, diabetes, and other cardiac ailments in that order. Increase your mortality from 50% going up to 110%. And last, most importantly, is with other comorbidities and the children being at home, they can be reservoirs and pass the infection on to the elders. All the more reason that your parents must get vaccinated. A very quick word and just 2 lines on the so-called scare in people's mind, especially in the elderlies, about the vaccination and the complications. Please rest assured that they are so rare that it is like lightning striking one person twice in a day. The overall risk of any thromboembolic phenomena with the vaccines which are available in India is 0.0008%. The general population carries a risk of 0.1%. A smoker or a person on oral contraceptive pills carries a risk of 1 to 2%. But COVID itself causes 18 to 20% risk of thromboembolic phenomena or blood clots. So it is safe, it is very effective. All studies internationally have shown the effectiveness to be crossing more than 90-95%. Please get it done. The vaccines will prevent serious infection and death.
Well, some very important points that have already been raised by our experts. So what I would essentially like before I go to another call is try and recap of what our experts have essentially said so far. One thing becomes abundantly clear, that do not panic and immediately seek for a hospital bed if you have mild symptoms. The best option is to isolate yourself. That's one thing that we have picked up from the discussion that we've had over the last 15 to 20 minutes. The second thing is that avoid stepping out of your house unless it is extremely essential. And if you do step out, then ensure that you are masked up. As Dr. M.C. Mishra was pointing out, if need be, even go ahead with a double masking. Now, let's also focus at some other concerns that many people have. In fact, I'm told that Kamal is joining us on the phone line. He's calling from Mumbai. That's another city where we have seen a huge spike. It is almost 20 to 25% of the COVID infection that the entire country is looking at. Kamal, go ahead and ask your question.
Yeah, thank you very much. Good evening to all the doctors. Thank you very much. My wife has already taken Covishield first dose, and the second dose is due after 28 days. In between, she had COVID. So now is she supposed to take on 28 days, 45 days, or later?
Dr. Vivek, perhaps a lot of people have actually gone through a similar situation as Kamal is going through at this point in time. What is it that you would like to suggest?
Basically, I agree that there are patients who have developed COVID after taking their first vaccination shot, because the first vaccination does not ensure adequate immune response. That is why the need for 2 vaccines. One for Covishield, it has to be at least 6 to 8 weeks apart, 2 doses. Now that somebody has experienced COVID infection, then it is important for the body's immune system to just rest for 4 to 6 weeks before it is challenged again with the vaccine. So you should keep a gap of at least 4 to 6 weeks from the recovery of the COVID infection to the next dose of vaccination. But if you've received plasma during that period, then you will have to wait for some more time, probably up till 12 weeks, before you can take the next shot of COVID vaccination.
Dr. Vivek, what I would like to do right now is perhaps look at certain scenarios that a lot of people would be going through at this appointed time before we connect some more of our callers who are joining us right now. Dr. Vivek, if assuming a situation basically comes up where I have a certain symptoms, but I also see a situation where the oxygen saturation levels have dropped, what is it that a person can do if the person does not have any access to any hospital, or for that matter even a primary health center, and the person has to be at home? What happens in a situation like that? Is there anything that one can do if the oxygen levels drop?
See, the ideal situation would be anybody with a low oxygen saturation should be heading to the hospital immediately and not delaying it. Because in the hospital, one uses certain IV medication which can help in the recovery in controlling the inflammatory response that is going on in the body. All this reaction and low oxygen state is probably a reaction, is a response to a dysregulated immune system, which is not coming under control. So in a situation like this, what has seemed to be working the most is the IV steroids, and they seem to be controlling this inflammation very well. If it is not possible to reach the hospital, then probably there should be a place where they can at least be given oxygen to maintain their oxygen saturation above 90%. People target around 95, 96%. We don't need that much. We just need it about 90, 92%. Even up till 88% is okay. And one can feel safe. But what can probably somebody do there at that time is take high dosages of oral steroids. I mean, that is the only substitute I can think of right now. Although doesn't come as a recommendation. Recommendation is only that if somebody has a low saturation, he should be hospitalized immediately. But if there's nothing and it's dire circumstances, then probably one could try oral steroids in a situation like that. Or if it is possible to manage an IV setup there, wherever they are, then probably manage IV steroids and the other supportive treatment that one can use in a situation like that. But we have to remember that
joining us on the phone line is Mamta Singh calling from. Well, that's right. Dr. Vivek, I'll come back to you once again. Let me just connect one more caller. Mamta Singh joining us from Bhubaneswar. Mamta, go ahead and ask your question.
Yes, good evening, sir. I am Mamta. I am calling from Bhubaneswar. Hello,
Yes, Mamta, we can hear you. Go ahead, ask your question.
Yes. Good evening, sir. My name is Mamta. I am calling from Bhubaneswar. My question is that now in the heartbreaking situation, so many people and so many people are affected skin diseases, any more other diseases, now taking their medicines and others. So in the heartbreaking to that, medicine to stop here, that medicine should be continued. So my question, another question is that if I have a small kid, it's a 3 months baby. So when I am going to hospital for vaccination my baby, so it should be used for mask for my baby or not? My question is that.
Okay. Well, that's very important. Dr. D.K. Gupta, you're a pediatrician also. Let me bring you in right now. What happens for perhaps infants, households who have infants and they have to take their children for vaccination? Would the children also have to be masked up? What is it that you would like to advise, Mamta?
Great, that's a great question. I think routine vaccination should not be delayed at all due to this pandemic, because they will be high risk for developing other disease other than COVID also. And you have to go to the hospital with appropriate behaviors. And children above 2 years can put mask, and below 2 years they will not be it will not be feasible and practical also to put mask on them. Then it is mother's lab or mothers should take care while bringing in hospital that we should follow all the physical distancing, hand hygiene, and it should be nearby non-COVID facilities, green areas where we can got his or her vaccination. I think that will be the best answer.
Right. We have another caller from Hyderabad. Shreyas from Hyderabad is joining us. Shreyas, go ahead, ask your question.
Good evening, doctor. My wife is not COVID positive. Her tests have come negative. Now, the situation here is I'm not seeing all the COVID symptoms in her, but there is high temperature, cold cough, sore throat, and body pains. Now, what should I do in this scenario, and what should be my next step? I also have a small baby at home, and I'm not understanding what exactly is to be done here.
Right, Shreyash, let me take this question to Dr. MC Mishra. Dr. Mishra, a situation like this, in the same household, there are people who have turned positive, some have tested negative. In this case, Shreyash is saying that his wife has tested negative, but there are still mild symptoms that he's essentially seeing, and also there is an infant in the house. So what does one do in a situation like that?
Yeah, everybody should be considered COVID positive, and this naturally the small baby will also carry the risk of getting infection from these adults. So as much they should use, mother should use the mask, nobody else should handle the baby, and whatever care has to be given with extreme caution and hope for the best, because if they can get this baby to their grandparents or someone, and if that is possible, then that can be considered. Otherwise, you have to take, mother has to put on mask, and nobody else should come near the baby to protect the baby, and mother should be considered COVID positive irrespective of what is the report. And I would not even ask them to get the report done. If she is mildly symptomatic, it is COVID and nothing else but COVID. So consider and treat like that.
Well, thank you very much, Dr. MC Mishra, for answering this question. Let me also bring in Dr. Sanjeev Bagai before we connect to more callers right now. Rama Rao from Sikandrabad is joining us right now on the phone line. Mr. Rao, go ahead and ask your question.
Hello? 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 मैं सिकंदराबाद से बोल रहा हूँ. मैं कोवैक्सीन last month March 15th I have taken first dose of Covaxin. Now 28 days are over. From last week I am at the hospital where I have taken first dose. They say vaccine is shortage. So now what I am so how many days gap I should have to take a second dose? They say next week you talk to us. We will expect some doses. Second vaccine. Because that I'm after all the hospitals. Can I take in some other hospital also? Instead of going to that, because some other hospitals, they are also having that. They say we will not give you, but you go to same hospital where you have taken first dose. What is the correct procedure?
Okay. Okay. Very important, because Dr. Sanjeev Bagai, just to take it forward from where Mr. Rao left, because even we've had various viewers asking this entire question that, the second dose is up next, but the doses are not available. Several such reports are doing the rounds. So for people like Mr. Rao who've gone to hospital, figured out that there is no second dose available, what do they do? Should they look for another hospital? What's the procedure like?
Okay, so just let's focus on a particular vaccine, which is the Bharat Biotech, which is Covaxin. Now, the recommendation there is 28 days, which is about 4 weeks, which is a month. If it is up by a few days, even up to a week or 10 days, nothing much is going to change in the body, rest assured. Point number 2 is you can go to another hospital, but don't change the company platform. So if you've taken Covaxin, stick to Covaxin. Point number 3 is your body levels of immunity which are building are suddenly not going to decrease if the vaccine for any reason is given a few days or even a week later. Your body has various arms of immunity which will sustain your response if you get it a little later. You can go to any hospital because it is not hospital driven, it is individual driven through your identity like Aadhaar card or any other ID card. The very important point here is don't make a gap of 4 weeks into, let's say, 2 months or 3 months or 4 months, then the immunity may wane. But plus or minus few days, even up to a week, 10 days, is not going to make so much of difference. So rest assured, you can go to any hospital, but my suggestion is take the same platform. Don't change the name or the company of the vaccine.
That's very important. We have another caller from Mumbai. Chatru Baharwani is joining us. Mr. Baharwani, go ahead, ask your question.
Hello.
Mr. Behrbani, go ahead, ask your question.
Doctor Saab, I was COVID positive 1.5 months back. I had recovered 1 month back. So will I get, though I'm taking very good precautions, will I get back again same COVID? Will I be positive again about the COVID?
Okay. Dr. Vivek, well, we have already seen several such cases coming up that if you've tested positive about a couple of months ago, there is no guarantee that you're not going to be infected again. But Dr. Vivek, would you like to take this question?
So in a situation like this, there can be 2 or 3 case scenarios. One is that probably if this he was just to retest himself without any symptoms, the COVID virus may still be positive. The RT-PCR test may still be positive, but that doesn't mean that he's infected or is transmitting the disease anymore, because we know that this virus loses its viability to transmit to others after about 10 to 14 days. It is no longer transmissible after that, even if the RT-PCR test is repeatedly coming positive. One is that. Second is that within the first 3 months, if he was to again start developing symptoms like fever, joint pains, body aches, those kind of things, that is called a long COVID. It is not called a reinfection. That's called a long COVID, where up till at least, I think 6 to 12 weeks, people could keep having these low-grade inflammation, which is related to a smoldering kind of an effect inside the body, resulting in symptoms. And RT-PCR could be positive, could not be positive. Now, third case scenario is a reinfection, where if somebody has symptoms and tests himself again, and RT-PCR this time again turns around positive. So this is where the genomic analysis becomes important for us to understand whether it is recrudescence or a reactivation of the previous infection, or is it a reinfection with a different genetically composed virus. So a genomic study would be able to tell us whether this is a reinfection or not. So these are the 3 case scenarios. One is long COVID, one is asymptomatic shredder, and the other is a reinfection. Usually it has been seen that people do not get reinfected for at least 2 to 3 months. There are, of course, rare case reports which have shown that there could be reinfections earlier also, or a secondary infections earlier also, but they are rare. There are only limited number of case reports that have been published from across the globe. And it has actually been seen people who develop a second COVID infection after the first one usually have a more severe reaction to the first one. I want to emphasize here that it's very important for people who've had COVID not to let their guards down thinking that they've suffered the infection and now they cannot get this infection again. They should still continue with all the COVID-related behavior, like wearing a mask, maintaining social distance, keeping their hands clean, getting their vaccination done as and when required, restricting their movement outside as much as possible. This is a time where you should be moving out only if it is very imperative, otherwise not. So the COVID etiquettes need to be followed at all times by all of us.
Well, thank you very much, gentlemen, for putting this into perspective. However, before I end, I would like to take some closing comments from each of my panelists, because it's important. A lot of viewers have tuned in right now. One final message from each one of you, less than 30 seconds. I'll begin with Dr. Sanjeev Bagai. Mr. Bagai, Dr. Bagai, go ahead. Your message to all our viewers right now.
Don't panic. Wear a mask before the first vaccine, wear a mask in between the 2 shots, wear a mask after your second vaccine, wear the mask throughout this year at least. Point number 2, do not socialize, try to stay at home, work out of home, pray at home, pray from home.
Right.
Do not believe in anything else except medical science.
Dr. D.K. Gupta, a quick comment.
Improve vaccination, speed up vaccination. Number 2, appropriate COVID behavior should be implemented very forcefully. Third, partial lockdown everywhere till this COVID is controlled. Fourth is early diagnosis and early treatment and aggressive treatment, those who require, and segregation of the beds.
Dr. M.C. Mishra, a quick comment. What is it that you would like to tell our viewers?
The same I would repeat. The only savior at this point of time is mask and mask. Even if distancing is not possible many a times, Don't run after remdesivir or favipiravir. These are not the drugs which will surely save your life. So don't get this illusion that if you get remdesivir, if you get these antiviral medications, you will be all right. Your well-being would depend upon your lung involvement. If you can prevent your lung involvement by using this mask, you will not go to ICU, you will not go to the hospital, you need not to worry about. Foremost, prevention is 1,000 times better than any cure for COVID.
Right.
Thank you.
Well, one final comment from Dr. Vivek. Dr. Vivek, what is it that you would like to tell our viewers before we end this discussion?
In just very simple words, that it's important for us to exhibit self-restraint at this time and not coerce the government to implement measures like lockdown, which can be very counterproductive for our society, devastating for the economy. It's very, very important to stay indoors, wear your mask, keep your hands clean, maintain a social distance from people, get your vaccination if you're eligible for it, and do not rush to the hospital at the first symptom. Get yourself tested. Isolation and appropriate treatment at home can also make you overcome this severe illness.
Well, thank you very much, all our experts who've joined us in this broadcast, certainly answering a lot of questions posed by our viewers. One final message to all our viewers who are tuning in right now: it's best to stay indoor, step out only when it is essential, and as all our experts have pointed out, mask up. That's the one important thing that you can do.